Good afternoon. Today is Friday, February 16th, 2024. I'm Donna Will, Professional Development Coordinator for the Maryland Department of Health's Developmental Disabilities Administration. We welcome you to the DDA Waiver Application Process Training. On the panel today, we have Rhonda Workman, Director of Federal Programs, Ama Owusu-Donkor, Director of Waiver Eligibility, and Linda Yale, Deputy Director, Western Regional Office. Before we begin, I'd like to go over a few things about the webinar. All participants are in listen-only mode. There are two options to hear the webinar, by computer and phone, and if you look at the panel interface on your right, labeled audio, you can click either computer or phone to switch for the best option. We have a handout for the webinar, and it can be downloaded from the handout section, or if you're listening by phone, you can request that it be emailed. We will be recording the webinar and posting the session on YouTube and the DDA website. Today's PowerPoint has been uploaded as an attachment and is available for you to download in the webinar panel box. Questions can be typed in the question or chat box in the webinar panel, and we will get to those towards the end of the presentation. So now I'd like to introduce Rhonda Workman, Director of Federal Programs. Good afternoon.
Thank you, Donna. Good afternoon. On behalf of the entire DDA team, we want to welcome you today to today's training on the new concurrent waiver application processes. Joining us today are various DDA partners, such as providers and others who are interested in learning about the waiver application process. Our presentation is specifically geared towards coordinators of community services. During our questions and answer sessions, we will be addressing CCS questions only. For our other DDA partners joining us today, if you have any questions, we ask that you please follow up with your regional office. Please do not note questions in the chat box, as we want to make sure we're able to address the CCS's questions. First, it is important to note that we are not changing the DDA waiver application packet components. Today, we will be sharing how the components need to be done concurrently. We collectively support approximately 19,000 individuals and their families in need of home and community-based services to ensure that their health and welfare is ensured, and also to support their goals. To further support our collective priority for individuals to be enrolled and access home and community-based services as soon as possible, the DDA operated Medicaid waiver application processes are aligning with other Maryland Department of Health home and community-based service program application processes. And the new DDA concurrent eligibility processes that we'll be discussing today will support more timely waiver eligibility determinations. The new processes that we will be sharing today can begin today. We know that your agencies may be updating internal processes and procedures, and suggest that you connect with them and your supervisors and managers for any additional support that you may need. However, please note that the new processes will be utilized for our upcoming transitioning youth and all other individuals placed on a waive as of March 1st and thereafter. The DDA regional offices will be putting people, the transitioning youth, on waives on or before March 1st. Before reviewing the agenda, I want to ask you for your focused attention to our training today. Please close emails and minimize distractions. Please jot questions down during the presentation. Some of them may be answered in a later slide. If you have questions we have not addressed during our presentation, then please note them in the chat and question box. So for today's agenda, we're going to be sharing a brief review of the waiver eligibility requirements. We're going to provide clarification on the differences between the Medicaid waiver application versus the DDA waiver application packet, as these terms differ. We will start with a high-level overview. Think of 50,000 level view of the current waiver application processes, and then we'll talk about the new concurrent waiver application processes. We will also share 10 key concurrent eligibility processes. We will review the DDA waiver application packet and share important reminders for the various packet components. We will also review some scenarios, such as individuals in crisis or emergency situations, transitioning youth, and individuals leaving institutions. We will share some guidance related to the state review teams and ABLE accounts. Our last slide will also include some tools and resources, and we will end with questions and answers. So again, thank you for joining us today, and I am now going to turn it over to Amma to share and kick us off. Next slide, please.
Thank you, Rhonda, and good afternoon, everyone. Let's first review waiver eligibility requirements. To be eligible for a Medicaid waiver program, the individual must first meet waiver-specific technical, medical, and financial eligibility criteria. Applicants must demonstrate through a screening process that they need the level of support that people receive in an institution. They meet the waiver financial eligibility requirements, and they have a person-centered service plan that support their health and welfare. As a reminder, the DDA determines technical and medical eligibility, and the Eligibility Determination Division, EDD, determines financial eligibility. All of these steps can be completed at the same time. Next slide, please. Before we begin discussing the new concurrent eligibility process, it is important to distinguish between the Medicaid waiver application and the LTSS Maryland DDA waiver application packet. The Medicaid waiver application is the state application used for all applicants applying to a Maryland home and community-based service waiver program. Based on the individual's current situation, a long or short term care or waiver application is completed. The DDA waiver application packet is the LTSS Maryland form that includes an overview section with the waiver application status, enrollment checklist section that gets filled in when the level of care, person-centered plan, Medicaid waiver application, freedom of choice, and EDD release form are completed or uploaded. The documentation section that includes the Medicaid waiver application, freedom of choice form, EDD release form, meeting minutes or sign-in sheets, and other supporting documents like bank statements, trust, ABLE account information, etc., and workflow history section. The concurrent eligibility process we will be discussing today includes processes associated with both of these items. Next slide, please. This slide is a high-level view of the current waiver application process. This visual shows DDA regional office staff processes beginning with placement of the individual on an LTSS waive on day one. The CCS can also begin their work on day one by reaching out to the individual to set up a meeting and start creating the PCP and DDA waiver application packet. EDD does not begin their work until later in the process. EDD cannot begin their work until the Medicaid waiver application is submitted. Our current process, including last year's TYs, had a Medicaid waiver application being created and uploaded into LTSS Maryland after the PCP process. This results in EDD receiving the Medicaid waiver application at day 30 or later in the process. For individuals who do not have a federal disability determination, the state review team process is also needed. This process also does not begin until after the Medicaid waiver application is submitted. Next slide, please. This slide is a high-level view of the new concurrent waiver application process. Similar to the current process, the DDA regional office staff process begins with placement of the individual on an LTSS waive on day 1. The CCS can also begin their work on day 1 after receiving the alert. When reaching out to the individual to set up a meeting under our new process, the CCS can begin to share the waiver application process, including the financial supporting documentation that will need to be collected. The CCS will prioritize creating and submitting the Medicaid waiver application first. The CCS will also concurrently complete the various LTSS Maryland DDA waiver application packet process, such as the PCP, level of care, freedom of choice, and EDD release form. We will further review these and other actions in today's training. With the Medicaid waiver application being prioritized and submitted as soon as possible, EDD can now begin their work on day 3. By submitting the Medicaid waiver application first, EDD can begin to review financial and systems to determine the level of assets, income, and medical expenses applicants have. For individuals who must go through the state review team process, this can also begin as soon as possible. Next slide, please. This slide is a high-level visual of the old process and the new process. It demonstrates EDD being able to start their work as soon as possible and supports more timely eligibility determination and access to services. Next slide, please. This slide is a general overview of 10 key eligibility processes. The first step is the DDA eligibility application and determination. The last step in the process is the LTSS Maryland overall decision form. DDA regional office, CCSs, and EDD have specific critical processes to complete. For some steps in the process, one entity, meaning DDA, CCSs, or EDD, cannot begin their work until another entity completes a key process. Let's review each process and some important reminders. DDA eligibility. An individual has applied for DDA services and has been deemed DD eligible according to the Maryland statute. The individual is added to the waiting list. Waive placement. Individual is placed on an LTSS Maryland waive and provided an opportunity to apply to a DDA Medicaid waiver program based on assessed need. The CCS will get an alert that the individual has been added to a waive. The Medicaid waiver application and PCP program type must match the waive program type. Note, if the individual needs a different waiver program, please reach out to the regional office. Medicaid waiver application. The Medicaid waiver application, long and short form, is used to apply to a specific DDA Medicaid waiver program. Please note, this is the first step to be completed. This should be submitted within the first 3 days from the date the individual is added to a waive. Person-centered plan. The person-centered plan, or PCP, outlines an individual's goals and vision for their good life. A CCS must submit an initial PCP in LTSS Maryland for the same DDA Medicaid waiver program that is identified on the MA waiver application. Authorization of the PCP. The regional office program staff reviews and authorizes the PCP. This happens before the DDA waiver application packet can be submitted by the CCS for the regional office eligibility staff to review. DDA waiver application packet. The DDA waiver application packet includes the MA waiver application, the PCP, the level of care form, the freedom of choice form, EDD release form. All required documentation must be submitted in order to make an eligibility decision for the applied waiver program. Approval of waiver application packet. The regional office eligibility staff will review the DDA waiver application packet. If all documents have been submitted and passes the waiver checklist, then it can be approved. Financial eligibility determination. Upon receipt of the Medicaid waiver application, EDD will review assets, income, and medical expenses and apply special financial eligibility to determine if the individual is financially eligible. If the individual does not meet the eligibility requirements, they will be denied and returned to the waiting list. Overall decision form. The overall decision form can only be completed once the individual has been deemed financially eligible for the waiver. If the individual does not meet medical, technical, and financial eligibility requirements, they will not be approved for the waiver. Next slide, please. The LTSS Maryland DDA waiver application packet form includes a checklist that is associated with the various eligibility processes and requirements. The checklist is represented with a visual on the left side of the slide. As shared today, the various processes and documents can be completed concurrently, simultaneously, at the same time. The visual on the right side of the slide represents the same components but orders them differently to emphasize the importance of completed and emphasize the importance of the completed and submitted Medicaid waiver application first so that EDD can begin their work. We will review each component on the next slides and share important reminders. A reminder that individuals and families may be in crisis, transitioning from the educational school system, or have been waiting for services for some time. As a CCS working with these individuals and families, you are aware of their current goals and needs through your regular monitoring and follow-up activities and recent updates. Similar to the expectations we would have if we had a family member in need of DDA services and supports, it is important for all of us collectively to work diligently to complete the steps so that the waiver eligibility determination can be made and individuals can access services. Linda is now going to walk us through each component of the DDA waiver application packet and some of the important reminders. Next slide, please.
As we have already stated, the Medicaid waiver application must be prioritized so that EDD can begin their work as soon as possible. The CCS must prioritize creating and submitting the Medicaid waiver application within LTSS. When first contacting the individual, the CCS can begin to share the waiver application process, including the supporting financial documents that will be needed to be collected. The application can be pre-populated with all of the known information prior to the initial meeting. At the initial meeting, the application can be reviewed and updates can be made. The application will then need to be signed and submitted in LTSS Maryland as soon as possible. Please remember, you know these individuals and you've been doing their monitoring and follow-up with them. If they're a crisis case, you've written the PCA that was submitted on the crisis. They've shared their needs with you and you now is the time for you to shine and submit the documents so we can move them very quickly into the services that are needed. Next slide, please. As a CCS, you may be wondering, how do you know what waiver to apply for? The specific DDA waiver program that the individual can apply to is based on the program type noted within the waive. This slide includes a screenshot from the client summary in LTSS Maryland. Under the DDA waiting list, future needs registry and waive information, you can see where the person has been added to the waive and the waiver type that has been selected. In this example, the CS, meaning the Community Supports Waiver, has been noted as the application program for which this individual has been given the opportunity to apply. As per our guidance, children will be placed on a waive for the Family Supports Waiver. Adults 18 and older will be placed on a waive for Community Supports Waiver. Adults 18 and older with the assessed need for residential will be placed on the Community Pathways Waiver. Please note that if an individual needs a different waiver program than is noted, reach out to your regional office and share the assessed need with them. Next slide, please. The MA waiver application must match the waive program type noted in LTSS Maryland, as seen on the previous slide, and should have the following on the upper right-hand side of the application: the DDA waiver program, the CCS's initials, and the date that the document was signed. This slide is an example of this requirement. Next slide, please. The MA waiver application must match the waive program type noted in LTSS Maryland as seen on the previous slide and should have the following in the upper right-hand corner of the slide. The previous slide was the long-term application, and this is the short-term application. Next slide, please. The MA waiver application must be uploaded into LTSS Maryland in the documentation section of the DDA waiver application packet. Uploading this document allows EDD to start their financial eligibility determination process. The supporting financial documents should also be uploaded in the documentation section. This slide includes a screenshot of the DDA waiver application packet, the enrollment checklist, and documentation section where the MA waiver application was uploaded. Next slide, please. If the individual does not have all of their supporting financial documents, the CCS must upload the MA waiver application with the available documents. It's important to not wait until you have all the documents that are needed for EDD to begin their process. Documents that are provided after the DDA waiver application packet has been submitted to the regional office shall be uploaded into the client attachment section under financial documents drop-down option. This slide includes a screenshot of the client attachments new document, add new documents form. And as the documents we are talking about are part of the MA waiver application, the CCS will select the financial documents in the drop-down to add in any of those additional documents. Next slide, please. The MA waiver application has a 6 months consideration period, which begins on the first day of the month the application is received. For example, an application signed on February 21st, the consideration period for this application would be February 21st through July 31st. July 31st would be the end of the 6 month consideration period for this February 21st application. Any supporting documentation that is missing, EDD will send a request for information letter with the date that they would like the information to be returned to EDD. Applicants who do not comply within the designated timeframe will get a denial letter. Please note that if they submit the missing information before the end of the 6-month consideration period, the individual can still be enrolled. If they do not submit the missing information before the end of the 6-month consideration period, a new waiver application process will need to be done. Next slide, please. Applicants who do not meet those timeframes, again, we're going to review before this end of the 6-month period, will have to start a new waiver application. Next slide, please. The individual person-centered plan is also a component of the required DDA waiver application packet. The PCP is an outline of the individual's goals for a vision of their good life. A good PCP is comprehensive and ensures that the individual's assessed needs are met through various supports so that they can achieve their goals and objectives towards their defined good life. The PCP is based on information gathered during interview process, assessments, and meeting with the individual and their team. Next slide, please. All new waiver applications must have an initial PCP. The PCP program must match the WAVE and the MA application waiver program. As the CCS is working with the individual and conducting regular monitoring and follow-up activities, you are already familiar with the individual's goals and their immediate needs. The immediate service needs can be noted in the initial PCP for the waiver enrollment. The plan can then be revised as needed afterwards. As our collective goal is to support the individual in getting enrolled in the waiver and starting services, it is important to submit the initial PCP as soon as possible. The PCP can be pre-populated based on previous discussions and monitoring and follow-up activities. The initial PCPs can be submitted without a provider, and the initial PCP is also an opportunity for the individual to pick their annual implementation date, which is similar to a birthday in that once you pick it, it stays the same. Next slide, please. For people interested in self-directed service model, DDA will be offering self-directed service introduction sessions in the near future to help people further understand their roles and responsibilities. To prevent a delay in service, individuals can begin to receive services under the traditional service model while learning more about the self-directed service model. People currently in the self-directed services can also sign up for the introduction sessions so they can learn more about their roles and responsibilities. Alma is now going to share some information about the level of care, freedom of choice, and other supporting documents. Next slide, please.
Thank you, Linda. The next component of the DDA waiver application packet we want to review is the level of care form. Prior to entering a waiver program, individuals must be certified as being in need of waiver services and must meet Maryland's developmental disability DD eligible criteria, which includes a need for active treatment. The LOC form serves as documentation that an individual is medically eligible to participate in a DDA Medicaid waiver program. Next slide, please. The initial level of care form can be completed prior to or after the initial meeting and immediately uploaded into the DDA waiver application packet. Please be sure to use the current initial level of care form, which is posted on the DDA website. It is important to complete all required fields in the form and for the CCS to sign the form before uploading into LTSS Maryland. The link is in the slide above. Next slide, please. The Freedom of Choice form documents that an individual has elected to receive services and supports through a DDA Medicaid waiver program instead of an institution or some other entity. It also indicates that the individual understands that they can choose among service models and receive DDA waiver services from any of the approved DDA providers. It is important for the CCS to review this information with the individual so they are adequately informed. The DDA Guide to Services and Easy Read Guide is a helpful tool to share with individuals and their family. The form includes a box noting which service model the individual is interested in. Selecting a model on this form does not commit the individual to the selected model. As a reminder, people can explore the self-directed service model in the new DDA self-directed service introduction sections. Individuals can begin traditional services while exploring self-directed services to prevent any delays in getting their immediate needs met. Next slide, please. This slide is a reminder to use the current Freedom of Choice form and complete all required fields, including the individual's name and required signatures. Next slide, please. The next component of the DDA waiver application packet we want to review is the EDD release form. EDD can release information regarding the individual's financial eligibility to another person. The individual must sign the form and indicate who they would like EDD to share eligibility information with. In many cases, the individual indicates that they want the CCS to receive a copy of all financial information related to eligibility, so they can also receive letters and notices on the individual's eligibility status. It is important to update this form and submit the form to EDD when the CCS changes, especially when the individual chooses a different CCS agency. The form was updated to reflect all DDA-operated waiver programs and posted on the website at the link noted in this slide. Next slide, please. Lastly, we would like to review the importance of the supporting documents associated with the DDA Medicaid waiver application packet. A list of required financial documents are listed on the first page of the MA waiver application. As shared previously, during the initial call to the individual and family, the CCS should share examples of documents that should be collected for the initial meeting. In order for EDD to make a determination, it is important that all requested documents are submitted in its entirety. For example, if a bank statement is required and it is 10 pages long, the applicant is required to submit all 10 pages of the document. This includes the last page. If it's blank, it would still need to be submitted. And all information in the document is viewable and readable. Therefore, no sections or information should be marked, redacted, or blackened out. Next slide, please. If any supporting documentation is missing, EDD will send a request for information letter with a date the information must be returned to EDD. Requested documents should be submitted to EDD as soon as possible and uploaded into LTSS Maryland Client Attachment under Financial Documents drop-down option. Reminder, individuals who fail to submit required documents will be denied enrollment. They still have up until the 6-month consideration period to provide the documents before an entire new application must be submitted and the process begins again. Next slide, please. This is a screenshot of the various supporting documents associated with applying for an MA waiver program. We also included the links to the long and short forms so you can click on it and review. Linda is now going to walk us through some scenarios. Next slide, please.
We're now going to talk about a few scenarios. The new concurrent eligibility process will be used for all DDA applicants to support timely waiver eligibility determinations, including but not limited to TY, individuals in emergency situations and crisis, individuals in institutions. The concurrent eligibility process can be used today. The new process must be utilized for all of our upcoming TYs and all other individuals placed on a waive as of March 1st through 2024 and thereafter. Our TYs will be added to the TY waive by March 1st. Some of the regions will start adding those TYs after the webinar today. Next slide, please. So let's talk about TYs, as they are the largest group we support for the waiver application process each year. As per our discussion today, the MA waiver application is good for 6 months from the date that it is signed. This means that we can have the TY sign their application prior to May 15th, which was what happened last year. As the TY funding becomes available on July 1st of each year, the PCP effective date should be no earlier than July 1st. If people plan to start services after July 1st of their TY year, then that date would be noted. For example, some people take off the summer and start their services in September. Make sure that we don't submit those MA applications prior to that 6-month consideration period. Please contact the regional office if you need help determining what date you should put on the MA waiver application or as an effective date for the PCP. Next slide, please. This slide relates to individuals in crisis and in emergency situations. Their health and safety are in jeopardy, so we don't have any time to delay. Ask yourself, what support and timeline would you want for yourself or a family member who's in a crisis situation? These individuals have different situations that should be fast-tracked and processed as soon as possible. Remember, you know these individuals, you've been working with them. The CCS needs to immediately contact the individual upon receipt of the alert and complete the DDA waiver application packet. You can pre-populate a lot of information prior to actually having that meeting. The packet should be submitted within 3 days. Please reach out to the regional office for any assistance needed with this process or if identifying providers. Next slide, please. Individuals transitioning from an institution, nursing home facility, Holly Center, Potomac Center, Behavioral Health Hospital, must have an MA waiver application. If we do not have the transition date or it has not been determined yet, then we would do an advisory opinion. If we have a date and a location where the individual will be discharging to, then we will need to do an authorization so that we can get these folks transitioned back out into their communities. Next slide, please. It is very important that you contact the regional office to alert them of the transition date once the housing is confirmed so that the authorization request can be submitted to EDD. The advisory opinion is good for a specific period of time, which is noted in their letter. If housing is not identified by the date of the new waiver application, by that date in the letter, a new waiver application must be submitted and the process begins again. On the day of the transition, it is important to confirm that the individual was discharged. If the individual does not get discharged on that transition date, immediately contact the regional office and share the new discharge date. Alma is now going to share some information about the state review team and income and assets. Next slide, please.
Thank you, Linda. This slide relates to people being referred to another DDA Medicaid waiver program. Individuals who are currently enrolled in a DDA Medicaid waiver program with a new service need that cannot be met by their current program or will be exceeding the program age limit, for example, an FSW person age 21, may be referred to another program. So to be referred, the CCS must complete an initial PCP for the new DDA Medicaid waiver program. Once approved by the DDA, the CCS then completes the MA waiver application and continues with the new concurrent eligibility process. We have included a link to the related policy as a reference. Next slide, please. This slide relates to the state review team process. People without a federal disability determination will be referred to the state review team for determination. If the individual if the individual is over the age of 18 and does not have Social Security, they will most likely be referred to the SRT. CCSs can share the SRT forms with the individual and team so they can be completed and submitted to EDD as soon as possible. SRT forms can be accessed at the link on this slide. Next slide, please. This slide relates to income and assets. As part of the federal eligibility process, EDD will review the individual's income and assets to see if they are with the federally approved waiver program standards. Income and assets are based on the applicant's information only. Some people, even current waiver participants, may have monthly income and assets that can put them at risk of meeting or continuing to meet the financial eligibility requirement. To support initial eligibility and continued enrollment, CCSs should continue to share information regarding the option to establish Maryland Able accounts and special needs trust, which provides some protection under the under the Medicaid rules. We have included a link to the Maryland Able website on this slide. Next slide, please. This slide is a high-level visual of the old process and the new concurrent process. It demonstrates the steps in the process that has changed. A reminder, the requirements have not changed. A few items in the process has been moved around to allow EDD to start their work as soon as possible to support timely eligibility determination and access to services. the CCSs should prioritize creating and submitting the Medicaid waiver application first. The CCS should concurrently complete the various LTSS Maryland DDA waiver application packet process, such as the PCP, level of care, freedom of choice, and EDD release form. Next slide, please. This slide highlights the documents that are in the DDA waiver application packet. As shared in previous slides, the various processes and documents can be completed concurrently, simultaneously, at the same time. Here are a few highlights to remember. All documents can be pre-populated before the initial meeting. You know these individuals, you have been working with them for some time now. The MA waiver application should be submitted within 3 days from the date of waive placement. The PCP, the initial PCP, should be submitted within 10 days from the date of waive placement, and to use the updated level of care, freedom of choice, and EDD release forms in LTSS Maryland. Please feel free to print out this slide and other slides as desk reference tools. Next slide, please. This slide includes some redetermination reminders. CCSs should be on the lookout for redetermination letters. The letters will note where to submit the application and supporting documents, for example, EDD or the local Department of Social Services. Documents should be uploaded into client attachment. Redetermination applications go under the MA application section in LTSS, and supporting documents go under the financial documents section in LTSS. Similar to an MA waiver application, in order for EDD to make a determination, it is important that all requested documents are submitted in its entirety. Next slide, please. Individuals are sent 4 letters before they are disenrolled. If an individual does not meet the timeline or requirements, please advise them of their right to appeal the disenrollment. If appealed timely, which is within 10 days of notice, their services can continue until the appeal decision has been given. Please note, the individual has up until 120 days to submit documentation to be reinstated without having to fully reapply for the waiver. Next slide, please. This slide includes links to helpful tools and resources that you can use. Next slide, please. This slide has the contact information for the regional offices. Please feel free to reach out to them for any questions and technical assistance. Next slide, please. We're going to open it up for questions, and I'm turning this over to Rhonda.
Thank you, Amma and Linda, for sharing information with us today. And as Amma shared, a number of the slides has some really important information and some key information that you could print out and use as desk references. Just to kind of recap again, we are really looking to support our priority to get waiver enrollment determinations made quickly and for people to be able to access services as soon as possible. And we talked about our waiver application packet process. We're still using all the same components. We're just going to do them concurrently or simultaneously. And yes, different than what we've done in the past and talked about last year, we want you to submit the Medicaid waiver application first. And when you're calling people after you get that alert that says that they've been added to the waive, and you give them that call to let them know that now there's this opportunity to do the waiver application process, it's important during that first call to give them an overview of what's going to happen, remind them of the supporting documentation that they should be gathering, so that first meeting can be very fruitful and we can get that MA application in. As we shared today, if the MA application and the supporting documentation that you receive is not complete, go ahead and submit the MA application. We do not want you to hold that. As you get more information, you can upload it into the waiver application packet. And if you've already submitted the waiver application packet, then you would upload those documents under client attachments, under those drop-down options that Alma mentioned. It would be under the financial documents. And then with that PCP, we talked about the importance of getting that going quickly too. As you've been working with people that's been on the waiting list or transitioning youth that are excited about their new opportunities, you're aware of their service needs, you're aware of their goals that they're looking at. You've been sharing referrals to different resources while they've been waiting for this great opportunity to apply for our waiver services. So from that perspective, let's go ahead and get that PCP pre-populated. So for that first meeting, we can have those fruitful discussions there too. That includes the freedom of choice form, where you're going to be reviewing that option to receive services in the community versus an institution, and that EDD form for them to authorize you to be able to get some information if there's any financial documents or redetermination in the future. And then finally, we talked about various scenarios. We're going to use it for all people that are put on a waive. It's going to begin March 1st. You can begin it today. And we also talked about the importance of looking to see if someone may be in need of a state review team process. And if that's the case, then go ahead and queue up those forms and get those ready. And also continue to support people and tell them about the opportunities for using ABLE accounts, special need trusts, and other things that they can explore, so that we support people to meet the income standards and be able to be enrolled in the program. So we're going to go through some of the questions that you put. If you have additional questions, if you could put them in the chat box, we'll grab those. So the first question, and we got a few of these that are very similar. The CCSs want to know which form to use, the long or short form. Alma, can you share some information related to that?
Sure. When an individual has been placed on a waive and is selected to apply for one of DDA's waiver programs, the CCS will receive an alert within LTSS Maryland stating that the person has been pre-authorized for funding, and the alert will also prompt the CCS to complete either a long or short form based on their Medicaid community eligibility.
Thank you, Alma. The second question we got is, how does EDD know when a Medicaid application has been added to LTSS to begin processing? How do they know when additional documents are added to client attachments? And so I replied to this question to everybody to let you know that EDD will get an LTSS alert when the MA application is uploaded into LTSS in the waiver application packet. They'll get that even though the whole packet hasn't been completed. So once you upload it, and that's why we want you to do it within the first few days, they will get the alert, and that triggers them to start to do their work. In addition, when you upload documents into the client attachments, because let's say you've already submitted the waiver packet and you've received some additional bank statements or something, you're going to put them in the client attachment section, and there's a drop-down option related to financial documents. That's what you're going to select. And when you select financial documents, an alert will also go to EDD to let them know that financial documents have been uploaded into LTSS. Our next question, I'm going to ask Linda to help us with. The question, Linda, is, do we include services in the initial PCP if we know what they want? Can you share with us, Linda, a little bit about the person-centered planning and looking at assessed needs and that initial plan?
Yes, so for your initial PCP that you're going to submit with your waiver packet, we would expect you to list the services that are going to be needed to meet that need in the DSA. If you have a provider, you can also list that provider in the DSA. If you do not have a provider for all of the needed services, though, you can still submit that initial PCP without the provider, and we can revise the plan and add it at a later date.
Thank you, Linda. Our next question relates to the new self-directed service introductory event that we talked about. So more information will be coming out soon. And the question relates to whether people need to go to this introduction session before starting self-directed services. We highly recommend that people attend this introductory related to self-directed services to make sure that they are fully informed of their rights and responsibilities and roles under self-direction. People, as we noted in our presentation today, can begin traditional services while they're continuing to explore self-direction so that they can be fully informed of the service and their responsibilities of that. It is also a resource for people who are currently self-directing services that they can also attend these introductory sessions. So again, we highly recommend that people utilize this information before they make a decision and commit to self-direction. The next question relates to the long and short form, and the person is saying they used to send a fax, or they want to know if they need to still send a fax to EDD to request whether to complete the long or short form. So you should be getting that information with your alerts. If you'd like to continue to fax EDD, you're more than welcome to do that. The next question I'm going to share with you, is there a function that can be added to LTSS where letters uploaded by EDD can alert the CCS in the alert section? Can you talk about our future change requests in LTSS where we'll be able to get those letters and receive alerts?
Sure. We have been working with our LTSS partners, and we're working to make sure that once EDD uploads a letter, a CCS is getting an alert. I believe that went live a couple months ago, but we'll continue to make changes to ensure that the CCSs are receiving alerts once letters are uploaded into LTSS.
Thank you, Amma. And we're also looking to ensure that all letters are getting populated into LTSS and those alerts. So as we're working through that, we'll continue to expand that so that even miscellaneous letters are coming through. The next question, Linda, I'm going to ask you to help us with, and it relates to the initial PCPs again. And they're asking about that annual plan date of 7/1. And so the question is, so all initial PCPs must have an annual plan date of 7/1, or just the effective date must be 7/1. Can you talk a little bit about what that would mean for a TY versus someone in an emergency situation or leaving an institution?
Yes, so the effective date of the PCP is really the date that it becomes effective. So it is the date that services can start once the waiver is approved. If the waiver is approved before that date, you have to wait till that effective date to start those services. If the effective date is there and the PCP is approved, but the waiver has not been approved yet, you can't start those services until the waiver is approved. The annual implementation date, or AID, that is in our PCP is that annual date that every year you will have your PCP meeting and you will do your annual plan. That date does not have to be the same date as the effective date. However, that's the way it populates in the initial PCP. So make sure when you're in discussion with individuals that you talk to them about when they want to have their annual PCP date, and go in and change the date that the system automatically populated.
Great. And Linda, can you talk a little bit about in an emergency and someone leaving an institution? What kind of date should they be looking at if you're leaving an institution?
So if you're leaving an institution and you have a house or provider, the address of where the person's going to move to, and the team has agreed on a discharge date, that would be the effective date of the PCP.
Thank you, Linda.
Again, you would want to make sure that you are matching that annual date if they've had previous services, or allowing the individual to pick when they want their annual date to be.
Thank you. Linda, here's another question about the waiver application packet that you reviewed with us today. The question relates to the waiver enrollment checklist and the meeting minutes. Can you talk about whether those are still required?
The checklist and the meeting minutes are helpful for everyone. So we're asking that you use the checklist. We are not requiring that the checklist be uploaded, but we are asking that you please upload the minutes into that document. We are in the process of developing, refreshing those checklists and the minute template so that we can get that out to you and share what has been working for some people really well.
Great, thank you. Another person put in here, I just want to confirm that I understand that the new concurrent process is to submit the waiver application first before submitting the PCP. Is that correct?
Yes, that is correct. This is the only way that EDD can start working on their part. So it's very important that we submit the MA waiver application first.
Our next question, I think, relates to redetermination. And the question is, what determines if it will be EDD or the local DSS office processing the redetermination? Linda, can you talk a little bit about the redetermination data that your region is sharing and all regions share with CCS agencies for people with redeterminations, and whether it's an EDD or local DSS, and also the letters that would refer to the entity?
So we are currently receiving from Hilltop a report that lists all of the folks and their redetermination date. In that report, it also indicates whether that information needs to go to EDD or if it needs to go to the local DSS office. If you have questions about what has been indicated, please reach out to the CCS lead in your region and they can help you work through that. The other place that you can find out the information is in the letter that the individuals received. It will give you a contact person and an address of where they would like the information sent whenever you're doing your redetermination.
Great, thank you, Linda. There was another question about what is the source of truth for redetermination dates, which is a good question. And so for this question, we have shared in various CCS meetings with DDA that the redetermination dates in LTSS are not current or updated. You may recall we've been sharing lots of information about the Medicaid check-in and shared that during the Medicaid check-in process, a 12 to 14 month process, that the redetermination dates were reset so that they weren't all occurring at the same time. Keep in mind that the Medicaid population is more and broader than the DDA waiver. It includes people with community Medicaid. So what happened was those dates were spread out over a 12-month period. So it's important to look at the letters that will tell you the date that it's due. In addition, the data that we've been receiving from Hilltop and sharing with your CCS agencies includes the date for each individual that is required to do a redetermination. Please note that it's only a small subset of all our waiver participants that are doing the redetermination process. And so it's really important to pay attention to the data that we've been sharing with your CCS leadership related to redeterminations, the individuals, and their dates. Linda, we have another question about advisory opinions and wanting to get a little bit more details about the process. Some of the question says, who does the CCS contact to initiate this advisory? How is the MA waiver process affected when we do not know when a person may be discharged from an institution? Can you share a little bit of information about people in institutions and completing the waiver packet so that we can generate an advisory, and then having that discharge date so that we can request the authorization and approval?
Yeah, so it's very important from the date of admission that we are working to begin that process for discharge. So even though a person has just been admitted to an institution and may not be ready for discharge for 6 months or even possibly a year, depending on what their current situation is, it's important that we are preparing for that. That's where the advisory comes in. So an advisory application is submitted, and that, once it is approved, is good for a 6-month period. And that way, then when we have an address and a date of discharge, we can complete the authorization packet and submit it so that the waiver will be in place when the person discharges and their community MA will be able to be reinstated. If somebody is in for 6 months and their waiver advisory expires, and at that point we still do not have a date for their discharge, we would ask that you please do another waiver advisory. And what that is that you fill out your MA waiver application and submit that in the DDA waiver application packet and upload that. Then you would notify your regional office that that has been completed so an advisory ATP can be submitted. If you have questions related to any of this, please reach out to your regional office waiver advisory person, and they will be sure to direct you.
Thank you, Linda. Donna, can you go back to slide 11 for us, please? Someone is asking if we can review the waive date and where it appears again. And I'm thinking that may also relate to the available program. Can we go back to slide 11? Thank you, Donna. So Linda, do you want to review this again about people being on the waive and the available program, which tells the CCS which program to note in the MA application and creating the PCP?
Yes, so this screenshot is from the client profile page. The very last blue bar on the client profile page is this DDA waiting list, future need registry, and waive information. You don't see this on here, but below the added to the waive would be the date that they were determined DD eligible and that they were added to the waiting list as current request. And then once they're added to the waive, as you can see, the event is added to the waive. It tells the date that that occurred. They were previously in current request, and the available program listed there is CS. So that's the Community Supports Waiver. CP would be our Community Pathways Waiver, and FS is our Community or our Family Supports Waiver. This is on, like I said, the profile page in LTSS for each one of our clients. And this tells then their process from the future need registry to the waive to the waiting list and then on to the waive. Thank you. I was just going to remind everybody, if there is a reason that you don't think this is the right program, please reach out to your regional office to have that discussion about their identified need.
Thank you, Linda. Our next comment or question is, it used to be really important that the dates were the same on the waiver forms. Now it feels like this is no longer true, and we just date it as it is done. Is that correct? Yes, that is correct. Date the documents as they're done and be sure to submit them as soon as possible, is what we've talked about, so they can have different dates. The next question is, what happens if the person is added to the waive and the client and family are out of town for a week? There would be no ability to submit the waiver application in 3 business days. Thank you for sharing that. We recognize that there will be some extenuating circumstances that may impact our process for concurrent eligibility and trying to get more timely access to services. In these situations, it's important for you to note that in your case notes and also to share with the regional office. We will be looking and monitoring processes from start to finish with people being put on a waive to completing the waiver packet and also the EDD determination. So again, if there's some extenuating circumstances, please reach out, communicate, and coordinate with your regional office. But we know these people have been waiting for services, the importance of these services to support their goals and their health and safety. So we want to make sure that we're doing our due diligence to get the packet in and get people enrolled. Looking at some of our other questions, a few repeats, so bear with me for a second. A question as to whether families and participants will receive anything physical stating that they've been added to the waive, or is it solely the CCS's responsibility to inform them? This is the CCS's responsibility. You get the alert once we put the person on the waive, and that triggers you to do your process where you'll reach out to them to coordinate that initial meeting and go through the waiver application process and supporting documents, PCP, level care, freedom of choice, and supporting documents. How does the referral to the state review team fit into the timeline? It's a great question. So with the time frame, as we've noted, we would want to get everything done within 45 days or sooner. State review team processes, depending on if the documents have been submitted timely and completed, may take a little bit longer. And so we know that may delay some of our process. We're looking internally at opportunities to partner with our other partners related to the state review team process to see if we can do some improvements in that process too. But what we shared today is if you know that someone that's 18 and older that doesn't have Medicaid or SSI, it's more than likely they're going to have to go through the state review team process because they haven't had a federal determination of disability. And so in that case, we're suggesting you go ahead and queue up those forms and start to get that together so it can be submitted as soon as possible. The next question says, you mentioned that the Medicaid waiver application packet could be submitted to LTSS once completed by EDD to start its approval process. However, the LTSS only allows the waiver application packet to be submitted and uploaded and not submitted if the initial PCP is still in progress unless approved. What does the CCS do in this scenario? So this is a good question. And so this really goes back to one of our first slides where we were trying to clarify the difference between between the Medicaid waiver application and the DDA waiver application packet. Donna, if you can go back to slide 4, I'd appreciate it. So just a reminder that part of the DDA waiver application packet, which is part of LTSS, it includes one of the components as the Medicaid waiver application. So when you get an alert that someone can apply for a DDA waiver program, that then opens up the opportunity to start to create the DDA waiver application packet, which is referred to here on this slide on the right. You can start the PCP and you can also upload any documents. When you upload the MA waiver application, whether it's the short or long form, when you upload that into LTSS, that is going to give an alert immediately to EDD, even though the entire DDA waiver application packet in LTSS has not been submitted because the PCP hasn't been approved. So the key thing to keep in mind is 2 different terms. Get that MA waiver application first. That's the first thing we want you to prioritize. Upload it into LTSS in the DDA waiver application packet section under the MA application file number, and that will alert EDD immediately. Then you finish working with the PCP, the regional office will review that PCP, get it approved, then you can submit the entire DDA waiver application packet. That's a really good question. The next question was very similar. Are we submitting the waiver packet prior to submitting the PCP submitted? So again, you're submitting the Medicaid waiver application, short or long form. You're not submitting the whole packet because you have to submit the whole packet after the PCP and all required items are completed in it. Question related to, is EDD prioritizing new waiver applications over existing redeterminations, or will they all be processed in order of submission? We're working with our EDD partners to ensure completion and review of all existing pending applications, redeterminations, and also the new concurrent eligibility applications that will be submitted to them. Okay, there was a question that in the past, when they would submit information, EDD has said that the ATP is not completed and that we would have to look into it. So no worries related to that. We're working with our EDD partners. This is aligning with the other HCBS programs. So we will be submitting our authorization to participate after the financial determination is made by EDD. Okay, just reviewing. We got some questions about the state review team. We talked about that. People are still waiting on some decisions. Again, follow up with your EDD caseworker and the regional office if you have outstanding items and questions. Note that there's no link to the state review team forms. Donna, can we go to slide? Let's see. Looking at our tools and resources, and I don't see it there. Let's look at the state review team. If you go to slide 35, please, Donna. So on slide 35, the last bullet says the state review team forms can be accessed at this link. That's a link to the DDA website where we include our waiver documents, and it also includes the various state review team forms. Question if this process is different for people who've been state funded and now applying for a waiver. No, you want to continue and use the concurrent process, get the MA application done first. Person says they have a TY24, a question related to that. I suggest you really reach out to the regional office that can help you, but you can start to use this new concurrent process today, and it is required effective March 1st and going forward for all TYs and all people on the various waves. Question about the EID process. How does it affect this process? The EID would not affect this process. That could also be determined at the same time. Our goal is to get the waiver enrollment process completed. Question about starting traditional services while people are waiting for self-direction training information sessions. They will not have a provider because they are still self-directing. So to clarify for that, when people are coming new into services and they're looking at their options for the different service models, traditional and self-direction, if they're wanting to get more information and to be adequately informed about the self-directed model roles and responsibilities, they can consider starting with the traditional service model, working with a provider while they further explore self-directed services. Question, do transitioning youth Medicaid applications still need a May 15th date, or can they be dated as soon as 3/1? Linda, can you address that question?
Yes, because the Medicaid waiver application has a 6-month time frame, we can date those applications as soon as the individual is placed on the waive. And that should be submitted as soon as it's signed and uploaded so that EDD can begin their process of eligibility.
Thank you, Linda. So the May 15 date no longer applies to transitioning youth. Our next question was asked a little bit earlier, but let's go over it again since it's on here again. We were instructed to date all the documents with the date of the waiver meeting. Is this still the case? No. the date, each of your document when you receive them or when they're completed, and get them into LTSS. They do not all have to match. Do not hold on to the MA application, the waiver application. Get it signed, get it uploaded into LTSS so we can initiate EDD processing. Question, when leaving an institution, will the regional office give email confirmation of authorization since state funding is not available? No, when a person is leaving an institution, an advisory letter would be issued, and on the day of the transition, it's important, as per the slides that we shared today, that the CCS is involved in that transition and confirms the discharge. If there's any change in that, we need to be alerted immediately, and we will be looking to confirm that discharge so that then we can ensure that EDD authorizes them and activates the PCP. Question about whether CCSs can know if EDD has begun to review the MA application, since submitting is only uploading the document to the waiver application. So remember, you're uploading the MA waiver application, the short or long form in the packet. So you're not submitting the whole packet. You're going to upload that MA application while the PCP is still in motion and you're completing the DDA waiver application packet. We will be monitoring and confirming that the application is received and the processing of that. EDD will check their financial databases. They will look at the supporting documents you found or that you provided. They will request additional information if needed. So that process will continue. It'll just be a lot sooner. For TYs, in which month are participants added to the wave? We noted today we will be adding our TYs to the wave on or before March 1st. Next year, we may do that a little bit earlier. We're going to use this concurrent process to ensure that we're able to move people quickly and get them to services. Question about, since there is usually an abundance of transitioning youth, what happens when the timeline shown is not met? Remember, we know these youth. We've been working with them. People at age 18 are included in our waiting list supports in terms of meeting with them and knowing their goals. And so we need to be ready to go and support these people. So they will be added on or before March 1st. And so we need to be ready and reaching out to them. Start populating those applications and the PCPs now. You don't have to wait for them to be on the packet. I'm sorry, you do have to wait for them to be on the wave for the PCP to be activated, but you can start to create those MA applications so that we can timely support these people to get through the process and get enrolled. Someone noting that they're excited about the new process, but has some concerns about some of the EDD processing. We are partnering with our EDD sister agency, and this aligns with the concurrent eligibility process with the other programs. Remember, to be successful related to financial eligibility, it is so important that we do our due diligence to support getting all the required supporting documentation and get the entire document to EDD, all 10 pages, nothing blacked out like we talked about before. That allows them to complete their process quicker and sooner. And so if anything's missing or they need to get additional information, they're going to request that. So we understand we're all working really hard collectively, including our EDD partner. We are looking to support this concurrent eligibility process and get people enrolled. Question about, what does a CCS do if they are not sure a person meets the level of care? They have been found eligible for DDA, however, the CCS feels that they have not met level care. Linda, can you address that question?
So I would ask that you reach out to your regional office to have that discussion with them. Once they are determined DD eligible, they should meet level of care. If something has changed in that situation, then you should reach out to your regional office to please discuss that situation.
Great, thank you. Linda, a question about the TY plans that need to be revised to add providers. Will there be an opportunity to revise the plans before 7/1/24?
The plans will be able to be revised once the waiver application packet has been approved and we have that overall decision form from EDD. At that time, there is the availability to revise the PCP.
Okay, the next question was just to wanting us to restate, please educate that the effective date for an initial PCP can be 7/1. However, we can choose any annual date we would like so that we do not end up having so many PCPs due 7/1. This is causing a significant issue with so many PCPs due July. Please note, we are a person-centered system, so the choice of the annual plan date is made by the participant. It is not made by the CCS. So you need to have that discussion with them. It can be a different date than July 1st, and their services, the PCP effective date can be July 1st. But please, please be sure that you talk and the person makes that decision. We don't make those decisions for the person. Someone has information on self-directed services. Can we do an initial PCP for self-directed services? Yes, you can do that. We are highly encouraging people to attend the new self-directed services introduction sessions so that they can be well informed about the decisions and roles and responsibilities. Question whether this changes in the way that the MA is assessed. Does the waiver packet still need to be mailed to EDD? The MA application is uploaded in LTSS. We no longer utilize paper waiver packets, so the waiver packets are not being mailed to EDD. Question about how individuals and family can sign up for the introduction session for self-direction. Communication will be coming out shortly in the near future, so stay tuned. I think we're just about at the end. It's almost 3:30. So I want to close by saying thank you so much for joining us today. We really appreciate you sharing your questions and your comments. If you put a question or comment related to a concern, related to a process, or a question about an outstanding situation, please reach out to your regional offices. We've included on one of our slides information for DDA contacts for each regional office related to eligibility. If it's plan related, please reach out to your CCS squads and program teams. Again, we appreciate you participating. Please utilize the slides for information and use them as desk reference. We look forward to seeing and talking with you soon. Thank you.